August 27th. Thank you all for being here. I want to thank all the panelists we have joining. I'll be introducing them shortly. And to get right into it, I like to open these up with a bit of optimism. So I like to say that disruption brings opportunity. There are going to be drawbacks, as we can anticipate, from the new schools. The way school is going to be taught and kids will be educated, but there will also be benefits. And there's a lot of interesting articles on this. I was just looking through the Kaiser Health News compendium of school opening and closing information, and there's a lot out there. I think let's look for the positives, and we'll work our way through the downsides of this. But I find it to be an interesting challenge. So I'll say it again: disruption brings opportunity. We felt it was important to discuss what getting back to school looks like for our community. And we also have several early educators, youth program subject matters here today to talk about their programs and how they're working to take fear out of the equation around COVID for children. And what's important to remember is that whatever happens at the community level, our dedication to continuing to suppress COVID can and will impact what happens in our schools and our ability to keep our children, teachers, and staff safe and able to participate at school in person. It goes beyond the start of school to what we do as a community to make sure we have our winter activities thrive this year in spite of COVID. As you all know, we've been working on a wear mask campaign. Wear the mask. I think that's been working. We've demonstrated this summer that we've, to a great extent, normalized mask wearing in the population, and we've seen a flattening of the curve. Let's hope those two are related and mask wearing continues to be normalized. If anyone has a picture, a selfie, or a good photo of them in a mask or someone, please send it to us to tracy.truelove@pitkincounty.com, and we'll post the selfie, ideally with a quote on why it's important for you to wear one. It does seem to be working. Let's see now. I think what I want to do first is introduce our lineup of speakers, and I'm going to turn it over to Josh. Josh Vance is our Pitkin County Health Epidemiologist. He'll be on. Dave Pressler, the CEO of our Aspen Valley Hospital, is here. Rob Stein, Roaring Fork School District Superintendent, is here. Eliza Robeson, Assistant to the Superintendent, is with us today, I believe. Katherine Sand from Aspen Family Connections is here. Keli Kirkpatrick from the Supervisor of Pitkin County Adult and Family Services. Michaela Idhammer Ketpura is here, Executive Director of Aspen Youth Center. Shirley Ritter, Director of Kids First, City of Aspen. Anna Cole, Family Services Director of Roaring Fork School District. And Larissa Dundino, Pitkin County Public Health. Thank you all for being here, and I think we'll just cut right into it. Take it away, Josh. I don't see you on my screen, but you're here. Oh, good, you're here, and you're sharing. Thanks.
I'm here, Greg. Yep. All right, well, hello, everyone. I'm going to give a quick, brief 5-minute update on our case count and just a few other things I want to touch base on and make the community aware of. So first thing to note is that since the 8th of August, we have only received 8 reports of positive cases here in Pitkin County. What you'll notice is that the majority of them, 5 out of the 8 were actually, 3 out of the 8 were actually out of jurisdiction cases. So they tested positive here in Pitkin County, but we transferred them back out to where they actually live. So what I want to show on this graph here is that we really have a pretty small window here where we were seeing cases. So we went 12 days without a report of a new case. And then in the last few days, we haven't seen a new case. We really saw just this really small window of time where we saw some new cases being reported to us. And these are the dates that they developed symptoms. So you'll notice that the first case we got reported to us developed symptoms on the 15th, and then the last case was on the 20th. And this person is actually asymptomatic, but this is the day that they were tested. So really, it's just a small window here where we saw just a few cases that were reported to us. Aside from that, we have not had any more cases reported in Pitkin County. And this, what I want to show is where we think these people were likely exposed to COVID. So looking at those 8 cases, 7 of them had an out-of-state exposure. So we saw a few different ones. We had Michigan, South Dakota, California, and then Florida, or exposed on an aircraft. Only one of these individuals in the blue had an unknown exposure. And so really what we're seeing is that, individuals that are traveling and leaving the area, there is a higher risk of exposure. Luckily, none of these cases, when they returned, exposed anyone else or infected anyone else. So we have not seen any what we call secondary generation of cases from these initial cases. And so they were really just isolated events. But I also want to be careful in saying that, just because these individuals had traveled and came back, some of these individuals are Pitkin County residents, some aren't. But it really just highlights that, COVID is still here in the U.S. We're still seeing plenty of cases nationwide. Just because we've seen a decline here in Pitkin County doesn't mean that there's risk when we leave the county. But also, we know that COVID is still here in Pitkin County as well. We just know that it's here in decreased amounts. But it still reminds us that we need to continue to do the things that we've been doing and not to be complacent. So again, while I show this graph, I don't want it to be seen as, people that are coming from other places are coming here and infecting Pitkin County residents, because really that's not what we're seeing. These are all isolated events. They just happen to test positive in Pitkin County, and we haven't seen any secondary generation from these cases.
Hey, Josh, quick question from Greg here. Regarding the ones who were out of county, were they in adjoining counties? Are Eagle and Garfield considered to be out of county?
No, these are all out of state.
Great, thanks for clarifying.
And something else I wanted to just touch base on real quick. This chart helps you determine the best time to get tested if you think you have COVID-19 or if you think you were exposed to COVID-19. And so just before I talk about the graph, as a reminder, it takes about 5 days on average when you were exposed to COVID-19 until you'll develop symptoms, if you will end up developing symptoms at all. But it can sometimes take up to 14 days, but that's pretty rare. On average, we see 5 to 7 days is really the median and the mean amount of time that it takes. So now if you look at the blue line here, this line represents the likelihood that your test will be positive if you actually have the virus. And remember that this is an average. Many people won't perfectly fit this model, but this blue line is just giving us a pretty good indication or idea of when or the likelihood that you would test positive based on this timeline down here. So notice that if you develop symptoms here at this area, about 1 week before symptoms, if you go get tested right away, this is a likelihood that you'll get a positive result, right? So it's very low. So if you were exposed to someone and then the next day you find out that they were positive and you go get a test, the likelihood that you'll get a positive result is pretty low. Now, if you wait until you develop symptoms, so wait about 5 to 7 days, you'll notice that the likelihood has gone up significantly. And so the odds that you'll test positive have greatly increased. The best odds are really a few days after you develop symptoms. So usually 1 to 2 to 3 days after you develop symptoms, that's really the ideal time. That's when the test is at its best and when you'll most likely get a positive result. So what we've really been trying to communicate is that if you're exposed to someone, you should be quarantining if you're aware that you were exposed and you haven't been contacted by the health department. So you should really just be quarantining throughout this period here. If you do then develop symptoms, really you'd want to wait a day or so before you schedule a test, because that's when you're going to have the highest likelihood of coming back positive. Our concern is that if individuals are getting tested here after they've been exposed and they get a negative result, our concern is that, the assumption is that I'm negative, right? I don't have COVID. Really, you're in that pre-symptomatic phase. And so you're just less likely to test positive. So we're really urging and just pushing individuals to consider, quarantining throughout this period and then really waiting a day or so after your symptom onset until you get tested. That's when you're going to have the best likelihood and that's when you're going to have the best results. So I just wanted to mention this again and just remind the community when the best time to get tested really is. And that helps us from a public health standpoint as well, because we'll get better results and we'll know truly who is more likely to have the disease than not. And then the last thing I want to touch on, since we have some school representatives here, is just how as a community we can go about supporting our schools, really from a public health perspective. And the reminder is that, again, as I mentioned a few slides ago, the virus is still here. We're still seeing it spread from person to person, but really it's large events, it's informal gatherings, it's not adhering to mask wearing, where we're seeing individuals become infected and then spread it to a lot more individuals. So, for example, we know the rally in South Dakota, we've already seen 100 cases connected to that rally. There's a wedding up in Maine, and there's been 85 cases now associated with that wedding in Maine, including one in a jail, an inmate. So it just spread extremely quickly. And then there was a high school in Biloxi, Mississippi, where the outbreak, they had a 15-person outbreak, I believe, there, and it was linked back to large parties. The reminder is really to, as a community, we all play a part in ensuring that our schools can open and operate safely. Because if our children or our teachers or our staff members are exposed to someone out in the community who may have been partaking in one of these events, it can easily get into the schools, right? And then from a school standpoint, it becomes extremely difficult to try to tease that out. And so we support the schools here in Pitkin County by really making sure that we're practicing best public health measures by wearing our masks, continuing the distance, washing our hands, and so forth. So I just wanted to make people aware that we're still seeing large outbreaks across the country. And really, in the end, it comes back to impacting schools and other events that we have here in the county. So I just wanted to make that point, just remind everyone that we all play a very important role when it comes to ensuring that our children can go back to school safely. So now I'm going to hand it over to Dave Pressler at the hospital.
Good afternoon, everybody. I'm Dave Pressler. I'm the CEO at Aspen Valley Hospital, and I'm happy to be able to represent the most recent information for AVH. Josh, if we can go to the next slide, let's first put this, the information I'm going to share within the context of what should be familiar to many of you now, which is the coronameter, which is provided by our Pitkin County Public Health team, and it is available at Pitkin County, on Pitkin County's website under COVID stats. So as you can see, the current status of the coronameter is more favorable, cautious, heading closer to comfortable than concerned. And you can scroll down, which I encourage everybody to do, to learn as much as you can about your community and the virus's impact on it. You can see each of the contributors to this graph, but I wanted to focus specifically today on Aspen Valley Hospital. So if we can go to the next slide, Josh, this is our what we call our capacity matrix, and this is available on the website as well. This is one of the contributors to the coronameter status, indicating the overall community status. And so as you can see, AVH remains comfortable in all three of our categories. On an inpatient basis, we are seeing 0 to 1 patient. We are actually now counting the number of days with 0 patients as an indicator for our own purposes. Today we have 1 person that is under investigation, but that is all. And we've had several days in a row without any patients being hospitalized with COVID-like symptoms. To Josh's earlier point, I do want to comment that oftentimes we will have a patient in the hospital that is suspicious because of their clinical indications and their laboratory and imaging studies, but they will test negative, and yet we'll still keep the patient and continue to test because it may turn positive and they may be having a false negative to start. Again, back to Josh's point about the timeline associated with when tests may become positive. So that's why when we say somebody's under investigation, we may not yet have a positive test but are suspicious anyway. In that middle category, we continue to be comfortable. This is where we were cautious a few weeks ago, and particularly after the 4th of July holiday, and we are really seeing relatively low numbers of patients in our emergency department, in our respiratory evaluation center, and that we are testing. We did about 45 tests last week, which is a relatively low number. As you can see, our capacity, at which point we would move back to cautious, is if we're seeing more than 16 patients that we're testing a day. And then finally, we are very comfortable with regard to a number of our healthcare workers that are out ill and likely related to COVID. So looking good on the hospital front. If we can go to the next slide. This is also available on the website and it is interactive. I encourage you to check it out and to hold your cursor over any of those bars indicating a week's worth of activity on the testing front. And you'll be able to see the number of negatives and positives, and importantly, the percentage of positives relative to the total. And what I wanted to point out is if you look at the yellow line, kind of like a sine wave, that is the 14-day positivity rate. And as of last week, it was 1.16%. That is phenomenal. We were really happy to see that. It had peaked out after the July 4th holiday at about 9.5%. So we're very pleased with that. We're continuing to do testing, as I've mentioned, and we'll continue to encourage our community to please contact your physician if you have symptoms, and they can refer you to us to be tested. Okay, and the next slide is I also want to join the chorus in encouraging everybody to continue to abide by the 5 commitments. Keep your distance, wear your face covering, wash your hands, get tested if you have symptoms, and certainly stay home if you aren't feeling well. This is Beatrice. This is one of our service dogs, and she is following the rules. I don't think she washed her paws necessarily for the picture, but we're just very proud of her for abiding by the 5 commitments. So thank you to the community, and I just want to reinforce our medical staff, our physicians' perspective, which is this is not the time to back down or become complacent. Let's keep up the great work, stay open, particularly as we move into the Labor Day holiday, reopen our schools, and look forward to a winter season. So keep it up, community. You're doing great. Don't back down. Thank you for your time this afternoon.
Great. Thanks, Dave. I think Eliza was going to come on and jump in just before Rob. Eliza, there you are. You're here. Take it away.
Hi, guys. I'm Eliza. I'm an assistant to Dave here at the Aspen School District. I think we also have Katie Frisch on the line with me as well. She's a member of our Board of Education. I'm also their secretary. Just a quick update from us is that we are planning a hybrid opening of K through 4 on September 8th. And they will be in small cohort class sizes of anywhere between 6 and 10 students. Students will come either on a Monday, cohort A, and then Wednesday is a complete remote day for everyone. And then cohort B will be coming on Thursday, Friday. This week, we had a soft start yesterday to remote learning, grades 5 through 12. And then their official start date is next Monday, the 31st. Other than that, we just implemented a required mask zone for the Aspen School District campus, which is being rolled out and in place now. And then along with, we are still figuring out our reevaluation process. I think it's going to be about every 2 weeks at this point. And obviously giving families, staff, and teachers a 2-week notice of any changes in the system.
Thanks, Eliza. I just want to add in thanks to the county and the hospital and everyone for helping us, navigate this. The chronometer is going to be very helpful in determining what the next steps are. And we are all, certainly from the board perspective, very excited to try to get the kids back in school as soon as possible. So, shout out to the community to try to maintain these 5 items and to really to be safe so that the kids can get back in school and our economy can continue to grow.
Thanks, Katie. Appreciate it. Glad to see you there. Rob, are you on? You up?
Yeah, I'm here. Thank you for inviting me. I'm the superintendent of the Roaring Fork Schools, which is the adjacent school district to Aspen, and we've taken a different approach. One of the unique qualities in Colorado is what they call local control, which isn't just a philosophy. It's also, by statute, school districts have a lot of authority locally to make decisions. And so we're seeing a patchwork of different approaches to how schools are reopening in the fall. And last spring, we took a stand that we wanted to follow two guiding principles. We really had more than two, but the two first were, number one, that we were going to prioritize student, staff, and community health and safety above all else. And second is, we learned last spring that we all prefer in-person learning, and we will pivot to in-person learning when it's safe to do so. As we monitor trends over the summer, we needed to make a decision with a bit of lead time. And in July, the case rates were very high, and so we decided to open our school year with distance learning only and then continue to monitor. As you've heard from Josh and Dave, they're trending very, very well right now. And so if we continue to see the trends that we're seeing, we will begin to introduce more in-person learning after the September 21 date we set for beginning to make that transition. We've moved away from this notion of hybrid that you heard Eliza talk about, just because it seems like what our goal is to increase as much in-person contact as is manageable and safe. And the logistics are very challenging because CDPHE has come out with some guidance over the summer around cohorting, keeping groups together, and limiting the numbers of adults, especially, who are in those groups. So we feel we'll be ready to transition a lot more younger kids, elementary age kids, to in-person learning after September 21 if the trends continue as they've been, in part because they're at lower risk themselves for the worst consequences of the disease, and they may also not transmit the disease as much. I know that's sort of a questionable finding, but it's something that CDPHE has given us as guidance. When we start to get to high schoolers, they're in much more contact with one another. As Josh pointed out, or Dave maybe, there are cases around the country where high schoolers have really been hotspots. And so it's going to be pretty concerning to imagine how do we really cohort high schoolers into the school. So it will probably take some time before we reintroduce a lot of in-person learning for high schoolers. And then the final thing is we prioritize what we call specially targeted student populations, either students who have like legal rights to special services or who are highly at risk. That actually includes elementary kids. They're much more vulnerable in this environment to lost learning. It's much more difficult for them to access learning in a distance learning environment. But for example, special education students who need therapeutic services, we've already started to ease those things back in programmatically, and we'll be increasing and prioritizing those kinds of services first. Nobody has mentioned this on this call, but we are very concerned about some of the consequences of disrupted learning, especially for our most vulnerable students. And we all know that, education is a relationships business, and our teachers are really making heroic efforts this fall to deliver instruction, but we're eager to keep moving forward. And I want to add my voice to both Dave and Greg, who said wear a mask. That's not something we're hearing everywhere, and we serve 3 counties, and the philosophies and messaging we're hearing is very different in Western Colorado. But if we want our kids back in school, we have to continue to work together to keep the incidence of the disease low. And likelihood is when we get more in-person contact, that's going to generate an increase in cases. And so we have to have, good habits and good infrastructure to be able to respond to that when it happens.
Great, thanks, Rob. If I could interject for a minute here before I bring on our early childhood and let's see, it looks off the screen, youth programs speakers. I just wanted to point out something in context here. There's an article in the Colorado Sun. I posted it on the chats from a couple of days ago, and it says it all with just the headline. It says, without a uniform state policy, it's been left up to Colorado's 178 school districts to decide how to proceed during coronavirus. And the quote from the governor is, I don't want anyone to be surprised in our state when classes and even schools do need to be shut down. So the Colorado's governor is expecting coronavirus school closures as in-person learning resumes. And, maybe it's just if we all accept that that's a possibility, it may be easier to move forward. Anyway, I posted that article if anybody's interested. And I think up next, what we have is early childhood and youth. Katherine Sand is on deck. Are you ready for us, Katherine?
Sure. Thank you, Greg. Hello, everybody. I'll go fairly quickly. I'm Katherine. I'm the director of Aspen Family Connections, which is the Family Resource Center based in the Aspen School District, and therefore very much tied to the Aspen School District, but actually we serve families throughout the county, as long as they have children under the age of 18, including little ones and kids not in school at all. What do we do? Well, we support families in a range of ways. We connect them to resources ranging from mental health, economic assistance, navigation, you name it. We probably try and get that for people. In COVID, we've taken on a few new kind of realms. We provide some economic assistance. I mean, I wish I could say we could pay everybody's rent, but for families with children, they don't have to be in our school district. They can be in the SALT schools. They're Pitkin County residents. We will help them with some bills. We'll help them with some of their costs. We also run the Aspen food distribution to the whole community every Wednesday. And just as a reminder, we're now doing that from Buttermilk. It's going extremely well in our new site, and we are serving about 200 plus households a week still. That's remaining very, very steady. And we'll be doing that as long as people keep saying, well, how long are you going to do that for? We'll do that as long as people need food. That's our commitment, and we're very pleased to be able to do it. And it's a great way for us of connecting to the community every week. We get to talk to lots and lots and lots of people of all kinds, not just families with kids, which is also quite good for us. So right now, our focus is overwhelmingly back to school. And in a sense, we are kind of in this rather unpleasant buffer zone between schools, families, trying to help families juggle the realities of some school, hybrid school, no school. And, you know, I really want to acknowledge the absolute no-win situation of everything. And I feel as a community, we have to own this discomfort. It's a very, very difficult time. Nothing keeps parents up at night more than their kids' well-being, their own financial well-being, and both of those things are imperiled by the pandemic. So I keep saying, you know, as long as well as wear a mask, we have to kind of hold our nerve, because we have quite a clear mandate in terms of our health and what we need in this community to stay on track and make sure that our return to some semblance of normality. And that also requires us to take a big, deep breath, like many, many times a day. So at Aspen Family Connections, we do a lot of the work that Rob alluded to, which is in identifying our most at-risk families, and that risk is manifested in many different ways. But those families who are going to really need extra support in terms of their employment, in terms of their children, we are trying to connect them to what child care options there are, and there are a few, and more are emerging. We're trying to encourage self-help solutions. We're connecting kids to different kinds of extra academic support, lots and lots of mental health referrals to help us all through this. And we're working with tons of partners and getting referrals from all over the place in that effort. So that's all very general. I would say if I had a message to the community is that we really do have to try and take care of each other. You know, finger pointing is not going to work, because frankly, everything we do is the least worst option. There is, you know, we cannot invoke equity because there's no equity. You know, we have to acknowledge that. I would ask employers, and I would reach out to employers to do whatever it is they can to alleviate the stress on their own employees who may have school-aged children, particularly at the younger age, because this is, you know, they're facing an impossible choice. So whatever employers can do, whether it is to come up with solutions, collective solutions, or to at least, you know, do whatever they can to enable parents to continue working. Because the other part of this, of course, is we know that we are going to be facing an interesting and challenging off-season. We talk about winter reopening, but we've got several months to get through before then, and families are already in some deep trouble. And in addition to that, you know, I would urge people to call Aspen Family Connections. If you live in Pitkin County and if you have children, and if you know, just want advice or a steer, you know, or be connected, give us a ring. Our number's 970-205-7025. It's all over our website. And we're doing a lot of proactive outreach as well, but we know that there are lots of families who haven't spoken to us yet. And I just want the community to know that we're there. We are absolutely there. We will find somewhere for everybody to go. So that's really what I have today. And yeah, I'm sorry it's not brighter news, but unfortunately I don't have a magic wand at this point. But the beginning of school will bring both pressure and some relief. I think for some of us and some of the families we're talking to, just the return to some kind of routine, some kind of expectation has been helpful. And the schools are doing all they can. I really fervently believe that, to make the return, you know, as decent and adequate an experience as possible.
Great. Thank you, Katherine. I think Keli, you're up next.
Hi, everyone. Thank you. My name is Keli Kirkpatrick. I'm the Child Welfare Supervisor for Pitkin County. We work really closely with schools and early childhood and Aspen Family Connections. Our main role is to assess for child safety. We have a lot of other roles though too, and that is to offer prevention services. We have case management services, and all of us here at Pitkin County view our job as helping families stay safe and together. We have seen a lot less referrals since schools and camps are closed, and so we are concerned about those kids that aren't in contact with someone who might reach out to us. And we've also seen the increase in mental health concerns, substance abuse, domestic violence concerns that just go along with the situation that everyone is in right now. Certainly, we all view our job as to support and want to really urge people to go ahead and make a call to our referral, the state hotline. That number is 1-844-264-5437. And don't be afraid, we really are just supporting our community when we know things are incredibly difficult for family and kids alike. Thank you.
Great, thanks, Keli. I was thinking Katherine gave us some numbers, Keli gave us a number. If you could post those in the chat, and then if anybody needs to access them, they'll have a database starting there. Okay, up next is Michaela. Welcome, great to see you.
Hi, thank you guys so much for having me. My name is Michaela Eidhammer-Ketpera. I'm the Executive Director of Aspen Youth Center, and we provide free after-school and all-day summer programs for kids in 4th through 12th grade in the Roaring Fork Valley, so from Aspen to Parachute. This summer has been very busy for us. We are on week 12 of 8-hour-a-day programs for 40 kids a week. So since June 8th, we've been open 5 days a week for the kids, to great success. The parents have been very excited, obviously, to have the support, and it is free, which is obviously super beneficial for a lot of our families. Moving forward into the school year, we just decided our new plan. So tomorrow is our last day of summer hours, and in 2 weeks, we will start our school year plan, which will include 3 groups of 12 youth in pods, or not pods, supervised learning. These kids will be enrolled in the school districts that they live in and do their schooling from there, but they will have a supervised place to be with someone dedicated to each group that will lead that group. So making sure they get off their screens and go outside for lunch, that kind of thing, and just keeping them on task, but also making sure that they're in a safe place when especially if their parents work somewhere where, you know, they can't be at their place of employment, or maybe their home is just not big enough to have multiple kids doing in-home learning and also parents working. So trying to fill a little bit of a gap. We will still do our after-school programs, and there will be 2 separate signups for that. So the goal is just to kind of fill in as much as possible. We do have such a great big space, and during the school year, normally during those hours, we're fundraising and, you know, planning our events and doing that kind of thing, planning programs. And so it seems like a shame if we weren't to use that space during the school year, especially during this time. So I will be sending out information about that soon. We haven't actually officially announced it yet because I got my board approval yesterday. So you guys are the first to hear it, but we are very excited to be able to help in that way. And the daytime program will have a cost associated to it because we do need to hire 2 new people to help, but there will be scholarships available through different avenues. So no one will be turned away if cost is an issue. That won't be a thing. But after school programs will have a separate sign up, and those kids will be free no matter what. And we're hoping to aim for mostly during the day 5th through 8th graders, and then 4th and up for the after school program, since the 4th graders will have some in-person learning at this point. But that's kind of what our plan is. And I also want to say that although it has been challenging, it has been so positive to see the kids interacting and participating and excited to be somewhere. And although I do have to remind them to wear the mask a lot, they do wear them. And I've got my mask, and I like to also check the kids in wearing this beautiful thing just to make them laugh, because, you know, you got to find the silver linings in all this. And yeah, so if any of you have any questions, I'll put my number in the chat box. But thank you so much for having me, and we look forward to helping out.
Thanks, Michaela. I love your shield there. That's going to impress a lot of kids, I'm sure. Okay, we're going to keep moving here. Up next, we've got Shirley Ritter she's the director of Kids First. Nice to see you, Shirley.
Good to see all of you. Thanks for having us on. I've got some good news, I think, to pass along. It's always a mixed bag, but all of our child care programs in Pitkin County are open. Most of them have been open since early June, serving the infants, toddlers, and preschoolers. There have been no positive results in the child care program, staff or kids. So we got to celebrate that while we can. Just a short report out, I think the child care programs have held themselves to a consistently high level of health protocols. Health and temperature checks as those kids come in, hand washing, disinfecting, sanitizing. They move the rooms around to accommodate social distancing to the extent that they can, mask wearing by adults and children to the extent possible. I think the support from our nurse consultant here at Kids First, who is Robin Strecker, and a strong relationship with public health has been a really critical piece of this success. They've reached out and they've been responsive and answered all of those questions from a lot of child care programs. There are some concerns. Child care directors have concerns about the illness exclusions, and they understand why it's necessary, but it could seriously hurt their ability to sustain their services, whether it's the children or whether staff are excluded because they have a symptom. They worry about recruiting additional staff, retaining qualified staff. Always a concern, but a pretty big deal now during COVID. I will tell you that enrollment is increasing. Programs are, for the most part, keeping groups separate and also keeping them smaller than usual. Some parents are still hesitant about bringing children to group care, but it varies. Some programs and in some classrooms, the enrollment is as high as 92% of normal. Others, it's as low as 30%. I would say the average is about 55 to 60% enrolled in early August, and we'll be getting new numbers in early September as we move forward on that. Kids First has traditionally supported young children, families, child care programs. You won't believe it, but it's been for 30 years, Kids First has been doing that. We have a variety of direct funding as well as services we provide to the child care folks on a regular basis. Now, during COVID, we've been authorized by City Council to provide support for rent relief, for cleaning supplies and PPE that the child care programs need, for enrollment subsidies since those programs closed and reopened. And the Kids First Advisory Board is looking to support programs and families as those needs change, because we know that we're in this for a longer period of time, and those needs have changed, and I think they're going to continue to change. And we want to be responsive so that we can have the most positive impact on those young kids, the families, the programs. So I will do the same thing. I would encourage your thoughts, your ideas, your concerns. your ability to help, and I'll put my contact information in the chat box so that that can be shared out. So thank you.
Great, thanks, Shirley, appreciate it. Up next, we have Anna Cole, who's the Family Services Director of the Roaring Fork School District. Hi, Anna, welcome.
Thanks,
Good
Greg.
to see you.
Great to virtually meet all of you. So I have a couple of slides I want to share with you today to talk a little bit about who we are as a Family Resource Center of the Roaring Fork Schools, what we do, how our work has shifted in a COVID environment, and then how to get in touch with us. A lot of this might sound somewhat familiar to Katherine's story. We're a Family Resource Center and do a lot of kind of similar services. It looks like our slides are slowly perhaps coming up. But the mission of our, there we go. Thank you, Andrew. The mission of our department and our organization is to strengthen student health, well-being, and academic achievement by partnering with families, schools, and communities. So we really work around trying to enhance and strengthen family partnerships with schools from an equity framework and a lens. We try to make sure that families have access to comprehensive case management, resource, and referral services. And we work really hard to make sure that families have access to integrated healthcare, which is, physical, mental, dental, and making sure that there is access for kids and families to those services. Okay, next slide. Our work is the heart of our work is around our family liaison program. So we have a bilingual, bicultural family liaison in every school in the Roaring Fork School District. We have 3 community-based early childhood liaisons. These folks really work to help families navigate the school system. They do case management, resource, and referral. And the families we serve are really, any family that lives within the Roaring Fork School District kind of boundaries, but families do not have to have kids in the school. And so certainly we work with a lot of Pitkin families living south of Basalt or south of Carbondale, and we work with a ton of families who work in Pitkin. So we have a lot of connections and relationships to and collaborations with our Pitkin partners and work with a lot of Pitkin families. We also act as a school district family services department. And so we also work when we want to strengthen family relationships with schools around family leadership and family voice, family governance, both in schools and communities and classrooms. And so our team facilitates the Family Advisory Council to our school district. It's a bilingual council that meets 6 times a year to kind of grapple with concerns that the council is kind of working on. That'll start up again in October and will be in a virtual format. We had great attendance with our spring meetings last year, and really we're able to use some of the kind of technologies that we can get through Google Meets and interpretation to make those meetings accessible. We also provide one-on-one small group and kind of parent education, community education around coaching and self-advocacy and leadership in the schools, trying to make sure that our leadership at every level in our school district looks like our community. And so we do a lot of work in that realm as well in our district. We also serve on a lot of district leadership teams. We work across our district and communities, again, around health access. We're excited this year to be rolling out a new school-based health center partnership with Mountain Family Health Centers, which will be, there'll be a school-based health center in each of our 3 communities, bringing dental care, behavioral health a little closer to kids and families. Our department also works with a lot of grant management and then does district wellness coordination. And then as you heard from Katherine, we couldn't do anything that we do without a ton of partnerships. And so we work really closely with external programs and partnerships. We work with the Colorado Community Response Program in Garfield County, providing additional intensive wraparound services for families. And then we participate in a lot of local and regional advisory and leadership committees. If we can move to the next slide. Our work in a COVID environment quickly shifted last spring to focusing on case management, resource, and referral services. So we, as kind of school shut down, our team went into high gear, reaching out with families, providing access and helping families access some of the economic assistance programs that were available in our counties, helping folks navigate those systems. We increased our resource allocation to be able to provide economic assistance and support for families. And then we supported our school district summer meal delivery program, which delivered, somewhere around 1,200 to 1,300 meals a day for free throughout the valley. And those meals actually were double those numbers because kids got delivered both breakfast and lunch. As we have moved into the fall and kind of prepared for school and thinking about our roles and strengthening partnerships, you know, our work has definitely shifted to support families with this new distance learning model. So we are doing a lot of tech support. We're helping families navigate online systems. Our district has rolled out some stronger two-way communication systems. So we're making sure that families can access that technology, make sure they know what's going on and how to get in touch with their principals and teachers. We're also working to reconnect and rebuild family-school relationships, which, as Rob noted, is tough in a distance environment, but we're finding unique workarounds and just happy to have eyes on kids again, as Keli really highlighted the importance of that. And then we're excited to, again, support the school-based health centers in Mountain Family, and excited, especially in this environment, especially moving into flu season, that we have strong partners around integrated health and prevention. And so what we're hearing from families are a lot of those tough decisions that Katherine spoke about, you know, as families are looking at, you know, the thought of school and the prospect of kids going back to school, and now trying to support families who have small children at home and want to be working, need to be working, and also need childcare and supervision for their kids. We have a lot of families in a really tough dilemma right now, making really difficult choices about, you know, how they're going to take care of their kids and take care of supervision and paying the bills. So we're trying to help families in this world. There's not a whole lot of great decisions here, but we've been buoyed by the kind of the resiliency and innovativeness of some of our families pulling together and self-organizing to find creative solutions, and are really trying to support those efforts as much as possible. The next slide has our contact information, and I can certainly add this to the chat box. Folks can, if they'd like to speak with a family liaison or get connected with our team, you can leave a message at our phone, there's a voicemail that you can call, the 970-384-9500, or send an email to familyservices@roaringforkschools.com. And then there's also my contact information, and Keli Medina, who's our Family Services Program Coordinator, for more information. And I'm grateful for the time, grateful for all the partnerships and support. Certainly would love people to reach out to us if you need anything or know anybody that needs some support. And again, I just echo everything you've heard everyone saying about the real collaborative effort we need to sustain around public health practices and mask wearing and hand washing, and, you know, trying to social distance as much as possible. It's really going to be a community effort that gets us back to normal and stabilizes a lot of systems in the community. So, thanks.
Great. Anna, thank you so much. That was an information-dense presentation, but I really appreciate it. And it's clearly we have a heavy lift, but we also have really great resources here. I'm encouraged. Up next, I think we have Larissa Dandino from our Pitkin County Public Health. I saw her on the list, and I'm hoping Larissa's here with us.
Hi, Greg.
She is here. Great. Okay, welcome.
Thank you. I'm going to share my screen. Okay, so I wanted to just share a little bit about a new guidance that was developed by the Pitkin County Public Health team for learning pods, also known as pandemic pods, micro schools, these learning support groups, supervised learning groups. They can be referred to many different things. So I just wanted to share a little bit about this guidance document. The purpose of this document was to help those families that might be considering joining or operating a type of learning pod, meaning that they're getting together for support during these times of online or hybrid learning. Maybe for those parents that can't, I think as Michaela had said, those parents that can't always be there for their kids during the day. And so we wanted to develop something that could help those parents that might be considering this to operate a learning pod safely. So there's two components to it. There's a checklist, which kind of just breaks it down and is a little bit easier to follow. And then there's the actual guidance document underneath the checklist that kind of delves deeper into the details if you're interested in reading further about some things that you could do to operate safely. And so some brief summary points from that is, we're asking limit groups to 10 students, practicing 6 feet physical distancing, wearing a mask, staying home when sick, washing your hands regularly. You know, a lot of these go along with the 5 commitments of containment. Opening windows for fresh air if you're indoors, considering outdoor learning and play. Again, as Michaela had said, taking those breaks to go outside and have lunch or play. And then frequently cleaning and disinfecting any shared spaces or high-touch areas, light switches, door handles, faucets, and then modifying meal practices to ensure that there's no self-serving or sharing of food at mealtime. And so that was just a brief summary of it, but if you'd like to look at the full guidance document, you can visit our COVID Pitkin County website and go to the Business Resources tab. And underneath the Business Resources tab, there's an education section, and you'll find the learning pod guidance there in English as well as in Spanish. And if anybody ever has any feedback that they would like to provide on this document, we are trying to provide the best recommendations, the best guidance that we can. So please feel free to reach out to us at any time that you have questions, or maybe you need additional guidance in this area. And thank you, Greg.
Great. Thank you, Larissa. I really appreciate it. I think we've got a little bit of time left. I don't know if anyone has a question. I did want to make a proposal. I've heard several people, Rob, Michaela, just now, Larissa, Anna, we've all talked about masks and mask wearing. And I'm thinking kids are going to be the ones who get most enthusiastic if we create something fun for them. So I've been toying with the idea of a mask. You know, you've heard about the mask fashion show already that we had up in Aspen. It was actually quite successful. I'm kind of wondering about a mask design contest. It might be a way to get our kids focused on making masks and actually learning what they're for and how they work and what makes an effective mask. And it could have a certain design and whimsical fashion element, and maybe we'll come out with a mask that's ideal for our mountain communities. That's my goal. So I just wanted to say, if anybody is interested, we could pursue this. It's just, the idea just came up, but I think as a prize to whichever school or organization, you know, wins this or, you know, takes home the prize, the prize could be probably about 40 or 50 custom-made fashion masks done by a local designer I know who cranks out the most beautiful masks. And I'm going to go out on a limb and propose that we make that the prize. But if that sounds interesting to any of you, let's talk about it. I'll talk to you about it in the chat or afterwards. You know how to reach me. But if we can incentivize and normalize mask wearing, it seems to be working. Washing hands, I think, you know, our moms do that for us. Hopefully we'll continue with that. Social distancing. Nowadays, when I see anyone close together at all in a movie, I get nervous. So I think we're social distancing more and more. So, but if anybody wants to hold a mask contest and have some fun with this, I'm always looking for fun. So thank you. That's what we have for today. If anyone has a question, I'm going to look around through the chat and see if anyone else is here who has a hand up. I don't see hands raised, and I'm not sure quite how to look. But I think it doesn't look like we do. It's been pretty comprehensive. It's been a good day. We're right at time or close to it. I guess we'll call it a day. And thank you all for being here today. I think Tracy can send out the chat, the contact information that was put on the chat, and we'll all get a copy of that. And if we can disseminate this far and wide, let's do. I don't know if any media is on, but thank you all for participating. We'll see you all in a week or two when I get invited back to moderate these things. Thanks a lot.
Thanks, Greg.
And Tracy, that's it, right? I think we're out.
Yes, that was a fantastic, yes, thank you. That was a fantastic, informative meeting. Our team will take all the information and kind of wrap it up in the recap we put out. If there's anybody that had slides they shared, but I have most everyone's slides and I can get them from the public health team, and I've got Anna's, but if anybody else had some that they want to email me at tracy.trulove@pitkincounty.com, we like to kind of, again, put that out on our social channels to the community. So thanks again for your gracious time. Have a good day.
So before you end the